Hello guys, so now we shall be discussing one of the very important topic in upper limb, that is the nerve injuries, and nerve injuries will definitely be asked in your exams. Okay, so there are different types of nerve injuries, and by the way you have got three major nerves in the upper limb. One is called as a radial nerve, one is called as a medial nerve, and another one is called as the ulnar. Okay, so first of all we shall see what is the course of this nerve, and then we shall discuss the injuries here. Okay, so to discuss the course of the nerve, I mean not a detailed course obviously, I'll just give you a brief introduction of this. Let us say that this is your humerus. Humerus, right? Now here you have got two important things. This is called as medial epicondyle. Okay, and this one is called as a lateral epicondyle. Okay, and all the way from here till here you call it as the shaft of the humerus. And second important thing is, wherever the head is there, that is the medial side, okay. So let us say this is the medial side and this is the lateral side of the humerus. Now important thing you need to know is that, first of all, how does the radial nerve pass? So this picture which you are seeing is from the anterior aspect. Okay, this is from the anterior view of your radius. So on the back side of the radius, on the posterior view of the radius, you have got a groove that is called as spiral groove. Okay, so radial nerve comes actually like this. Okay, and on the back side there is a groove called spiral groove at all. So it passes in between the spiral groove and then it comes down. Okay, and after coming down, it comes down all the way and it passes above the lateral epicondyle, not below the lateral epicondyle. Okay, whereas ulnar nerve passes behind the medial epicondyle. Okay, it passes behind the medial epicondyle. So let us say this is the ulnar nerve that is coming down and it is passing behind the medial epicondyle. Okay, and finally we have got one more nerve that is called as median nerve, and median nerve passes exactly above the two condyles, that is why it is called as supracondylar. Okay, so median nerve passes supracondylarly. So here this nerve over here is called as a radial nerve, and this one is passing in the spiral groove. Okay, and after that this is called as the median nerve. This is called as your ulnar nerve, which passes behind the medial epicondyle, and finally this is called as the median nerve, which is supracondylar. Median nerve, which is supracondylar. In the same way, ulnar nerve passes behind medial epicondyle. Behind the medial epicondyle. Okay. Now, what we shall do is that first we shall discuss about the radial nerve and then the remaining two nerves. Okay. So before we discuss radial nerve, again let me draw the same picture over here. This is the humerus. Right. So here one very important thing you need to know is that the root value of radial nerve is C5 to T1. Okay, the root value of radial nerve is C5 to T1. And remember one thing, radial nerve entirely supplies your posterior compartment of the upper limb. Okay, posterior compartment of arm, posterior compartment of forearm, everywhere it is supplied by radial nerve only. So one very important thing you need to know, and what is a posterior compartment called as extensor compartment. So radial nerve supplies the posterior compartment. Posterior compartment matlab extensor compartment. Extensor compartment. So this entire compartment is supplied only and only by radial nerve. Okay, right. Now let us look at how the radial nerve is passing. So this is the axilla region. Now in the axilla region, the radial nerve is coming like this, right? And now radial nerve passes behind the humerus. Posteriorly there is a groove called spiral groove. Let me draw this. See, this groove is called as spiral groove. Okay, so now this radial nerve passes within this spiral groove, and then this radial nerve is coming down all the way, and it passes above the lateral epicondyle, right? And as I already told you, this is the medial epicondyle, this is the lateral epicondyle. Now after coming here, it divides into two branches. Okay, so it divides into two branches like this. Okay, so one branch is called as posterior interosseous nerve, PIN. What does PIN stand for? PIN stands for posterior interosseous nerve, which is a direct branch of radial nerve. Posterior interosseous nerve. And what is the other branch name? It is called a superficial branch. Superficial branch of radial nerve. Superficial branch of radial nerve. What does a superficial branch do? It supplies to the skin on the dorsal side of the hand. Okay, so it supplies to the skin on the dorsum of the hand. So this is the important things which you need to know. Okay, apart from this, one very important thing you need to know is that even this radial nerve gives one small branch, and that supplies to a muscle called extensor carpi radialis longus. Okay, it even supplies to extensor carpi radialis longus. So very important thing you need to know. What is a very important thing is that, for example, okay, for example, this is the radial nerve. Okay, radial nerve के पीछे नीचे what are the branches which we have? The first branch is extensor carpi radialis longus. Okay, then we have written something called as superficial branch. Okay, and finally we have written something called as posterior interosseous nerve. So these are the three important branches which we have written. Yes or no? Now, extensor carpi radialis longus. For example, if extensor carpi radialis longus is injured, this would lead to wrist drop. This would lead to wrist drop. Just remember like that. Okay. For example, if the superficial branch is damaged, then the skin on the dorsal side of the hand, right, there won't be any sensation on the dorsal side of the hand. Okay, so you have to write it as there is no sensation on dorsum of the hand. No sensation on the dorsum of the hand. And in the same way, when posterior interosseous nerve is damaged, that would lead to finger drop. That would lead to finger drop. So if you remember these three important things which I have given, most of your MCQs will be covered. Okay, so let us discuss the cases now one by one. What will happen? For example, as I already told you, this is the axillary region. This is the axillary region. So in the axillary region, for example, if there is a damage to the radial nerve or there is a compression to the radial nerve. Now tell me the next part which is in the spiral groove, ECRL. So the remaining part of the radial nerve, will it work? Obviously it will not work. So if the remaining part of the radial nerve is not working, okay, let me first of all write it down. For example, in the axillary region, if the radial nerve is getting compressed. So first important thing, what will happen? The first important thing is that ECRL will work? No. If ECRL is not working, what will happen in a patient? Wrist drop. You will see wrist drop. Okay, then what is the second thing? Second thing is superficial branch is working in the patient? No. If superficial branch is not working, then what will happen? No sensation on the dorsum of the hand. No sensation on the dorsum of the hand. And third important thing is that, is the posterior interosseous nerve working? No. If posterior interosseous nerve is not working, what will happen? It will lead to finger drop. It would lead to finger drop. So these are the three important things you see when a radial nerve is compressed in the axilla. Now how can a radial nerve be compressed in the axilla, guys? Whenever you use long crutches, right? So when you are resting on the crutch for a long time, what can happen is that the axillary nerve, the radial nerve gets compressed. Okay, so that is why this is also called as crutch palsy. That is why this is also called as crutch palsy. Crutch palsy. Okay, so crutch palsy is the palsy of your radial nerve. So this is all you need to remember regarding if the injury is at the level of the axilla. Okay. Now let us say the injury right now is at the level of lateral epicondyle. Okay. For example, let us say patient is having a fracture of lateral epicondyle, and then see what will happen. And by the way, medial epicondyle fractures are more common than lateral epicondyle because medial epicondyle is more protruded inward. Okay. So lateral epicondyle is not that much protruded, and by the way, but still let us see what will happen in case of lateral epicondylar fracture. If this radial nerve is injured at the level of lateral epicondyle, what are the important things you see? The first important thing is that, for example, this is the place where I was telling you. Okay, yeah, exactly at this point, if there is an injury. Now tell me, if there is an injury at this point, will there be any effect to 𝐒𝐶RL? No, because 𝐒𝐶RL is located above to the injury. So will you see wrist drop in the patient? No. The first thing is, I won't see any wrist drop in the patient. There will be no wrist drop. Second important thing. So superficial branch is lost. If superficial branch is lost, then what will happen? Patient will have no sensation on the dorsum of the hand. There will be no sensation on the dorsum of the hand. Third important thing, posterior interosseous nerve is damaged. So you know that is there will be finger drop. Okay, so what is the only difference? The only difference is that wrist drop is not present. Okay, from the previous one, the only difference is wrist drop is not present. I hope you understood the second injury. For example, if the injury is at only interosseous nerve, that is posterior interosseous nerve, this is called as isolated posterior interosseous nerve injury or isolated nerve injury. Right? So if injury is only there, then what will happen again? Wrist drop is there? No. Sensation is lost? No. Sensation is intact. And finger drop is there? Yes. Patient will have a finger drop. Okay. So if there is posterior interosseous nerve injury, for example, okay, then what will happen? The first important thing you see is there will be no wrist drop. Right, sensation on the dorsum, of the hand is intact. But the third important thing is that patient will have finger drop. Patient will definitely have a finger drop. Okay, so this is an important thing. And how do you remember this is? Remember by a mnemonic REST. Respiration. Okay, what does R stands for? R stands for radial, E stands for 𝐒𝐶RL, S and P stands for superficial branch and posterior interosseous nerve. Okay, so these are all the details. And by the way, remember one thing, the radial nerve supplies only the posterior compartment. Posterior compartment is an extensor compartment, right? They are responsible for the extension of your upper limb. We keep that thing in mind. So we have discussed about the radial nerve, the course of the radial nerve. And remember one thing, radial nerve is passing in the spiral groove posteriorly, okay? And it passes above the lateral epicondyle, not behind the lateral epicondyle. Whereas ulnar nerve passes behind the medial epicondyle, okay? So here we discussed at three levels. One is at the level of axilla, at the level of the elbow, right? That is lateral epicondyle, and at the level of isolated injury of posterior interosseous nerve. Okay, so these are the three important things which you need to know regarding the topic radial nerve injury. Okay, so this is a topic of radial nerve injury. Thank you so much for watching. Take care and goodbye.